Good afternoon, everyone. I hope you're still awake. I know I had my cookie at the break, so I've got a little bit of a sugar rush going on at the moment. But so just to introduce myself, I'm Carole Morris. I'm Head of Data and Modelling Services at Public Health Scotland. Andy talked about starting a cohort at the beginning of a pandemic. Try starting a new organisation on the 1st of April 2020 with a public health function. So thrown in slightly at the deep end, but certainly woke everybody up and kept us busy. So that was really good. So I just want to talk to you about our membership within the Alliance, and also as part of my portfolio is oversight and running of the Scottish National Safe Haven / Trusted Research Environment, so I get all the right terminology in play. So I asked colleagues, what were the benefits? Why did we join the HDRUK Alliance? Well, apart from the fact we were very kindly asked to, which was really good. The group of people that I asked felt that from the Alliance, what we had was a really good network, really good sharing of knowledge and expertise. Felt like that we were part of the UK-wide family. So we already felt like we were part of a network of safe havens within Scotland itself, but this had our expansion. This allowed us to feel part of the UK and opened up so many networks and more collaboration opportunities for us to take forward. So, and I think over the last 2 years, we've been really an integral part of the whole HDRUK data and connectivity work streams under the National Core Studies Programme, which was really fantastic. So, in terms of sort of the power of data and data science, I think what for us the Alliance has brought is the ability to get out there, put it out in the forefront, is the richness of the data that we have available in Scotland. And the metadata, giving us an opportunity to hone that metadata to support data discovery. So the HDRU Gateway has been fantastic, and we point a lot of our researchers and our users of the National Safe Haven to that when they come and ask us kind of feasibility, excuse me, feasibility or availability of data within Scotland. What it's done as well is opened up those discussions that have kind of always been bubbling around about federated analysis and that kind of interoperability that was mentioned earlier across the different environments. So it's given us the opportunity to learn from others and look at different ways of provisioning data, looking at automation, and over the last couple of years with the data and connectivity work stream, we've been able to put some of that into practice, which has been fantastic. It's also, from my perspective, exposed me to new data types that I wasn't familiar with. Being bored in 2020 during the lockdown, I actually decided to do an online health data science course, as I thought, well, I should really know what my team are doing, and I should learn more about the different data types. So it gave exposure to genomics data, more on imaging data, told me a little bit more about data science tools, neural networks, etc. I don't think I'm ever going to become an expert in any of them, but it gave me that insight. The genomics particularly was useful for the pandemic for me. And also with the work across the pandemic as well, we were exposed to things like wastewater and environmental data as well. So some really interesting information that's come out of all of that, and that has been down to the work through the Alliance and through the networks and collaboration and the research activities that have been taking place. And as a result of that, of course, with all the different needs and different data types, you've got to expand the tools that are available to support those and the computational power within your environment. So that has challenged us, and it's given us the ability to develop new skills, new knowledge, and new expertise within the team. So I think two of the key things that have come out of it is, let me just check. Yeah, is two use cases that I can think of that are kind of big ones for us, especially particularly over the last couple of years, but actually over the last few years for the latter one. So the first one is what started off as a single research project was just, can you link the HDRUK 4C cohort to some Scottish clinical data, stick it in a study folder, and we'll go away and do our analysis, which has now evolved into developing a data platform. So the Outbreak Data Analysis Platform, which we're going to host in Edinburgh, is a collaboration between Public Health Scotland and University of Edinburgh and the HDRUK Consortium. So that is, excuse me, I think I shouldn't have had too much cookie. So that has made us look more at how can we increase the computational power available? How can we provide the tools necessary to analyse genomics data? And we've been working very closely with colleagues on the University of Edinburgh side. So we've got a split between the National Safe Haven that we host for Public Health Scotland and the split with the University of Edinburgh Safe Haven Secure Environment as well. And been working with them to develop that in to meet the standards of a TRE. The other use case that is in my mind around kind of skills and expertise is Scottish medical imaging. And that has been an amazing collaboration between University of Dundee, University of Edinburgh and Public Health Scotland. It started, gosh, I can't even think how many years ago, maybe 6, 7 years ago with FAR Institute, with a seed money that was to try and bring together population research-ready imaging data. And since then, it's grown, and we now have a population collection of historical imaging data, and we're working to turn that into an ongoing ingest of population-level imaging data. And that's opened up a lot more around modern data science tools and workflows, looking at how do we de-identify them, how do we use NLP, what other kind of AI machine learning tools do we need to be able to support. So the challenge with that has been working with, in collaboration with the academia side to understand these tools, but also working with the IT infrastructure side in terms of installing and maintaining and running these tools as well, which is just as key as being able to use them, to be able to maintain that and keep that going in the future. So that's an interesting challenge, of course, as evolution happens and new tools come into play. How do we continue to develop the knowledge and skills around those to be able to use them, install them, maintain them, and encourage others to use them as well? So just the other thing I was asked to talk about was kind of what might be future collaboration ideas for us as part of the Alliance. So going on actually some of the talks that have happened already, I'm probably picking up a lot of the ideas that have and thoughts that have been talked about already. So continuing on with the data and cohort discovery through the Co-Connect project, through the HDRUK Gateway, talking about federated analysis and data staying where it is and how do we manage that safely and securely across the UK. Looking at information governance and supportive innovation. So as we move forward and we're developing these black boxes of machine learning and AI, how do we as an alliance work around the information governance and convincing people that everything is okay and it is still safe and secure? But also the other end of it, the disclosure control side, what's coming out the other side? How do we make sure that that is fit for purpose and safe and secure in terms of the outputs that are going elsewhere? I think as well as an alliance, we can look at things like information sessions for researchers across the country. So we've got these TREs, we've got data holdings, we've got environments they can use. So how do we get that information out there? How do we build the capacity of the researchers in the future so that they have knowledge and they have some information before they come to speak to us in more detail? And I think I've already mentioned the AI medical imaging research, so I'll not talk about that again. So that's just, sorry, that was a quick whirlwind tour. Thank you very much for listening.